Okay, starting with the shoulder inspection, I'm looking at the pectoralis size and the shape on both sides to make sure they're both symmetrical, which they are. I'm looking for any elevation of one shoulder or the other, and those are both normal. I'm going to palpate the clavicle area for any tenderness, swelling, lumps, bumps, or abnormalities. Any tenderness?
No.
Same thing with the biceps. Any tenderness?
No.
And the axillary? Any tenderness?
No.
Okay, moving on to range of motion. For flexion, I'm going to ask her to move her arms forward and above her head. 180 degrees is normal, which that is normal. For extension, I'm going to ask you to extend your arms like this, backwards. And for abduction of the shoulders, I'm going to ask you to have your side arms like this. Okay. And adduction, I want you to hold your arm like crows. Internal rotation and external rotation, both at 90 degrees. Now I'm going to move on to the elbow inspection. I'm looking for the normal carrying angle, any flexion or deformities, any nodules, swelling, lash, lumps, bumps, and you can have RA nodules here that you want to look for, and all that is normal. I'm going to do an elbow palpation for any lumps, bumps, bruising, or tenderness. And anything tender?
No.
Okay, and for elbow range of motion, I'm going to do flexion, like showing your muscles, and extension, subnation, pronation. Now I'm going to do the wrist and the hand. I'm looking for any rashes, scars, lumps, bruises, abnormalities of the wrist and hand. And also you can look for RA nodules here as well. None are noted. I'm going to palpate the ulnar and radial for tenderness, swelling, and numbness or any abnormalities. Is all that non-tender? Okay. And for wrist range of motion, I'm going to do flexion, and extension, which you can also do like this and this. Okay, and then you want to do abduction and adduction, which is side to side. Okay, and all that is normal. And now I'm going to inspect the spine for the curvature, any scoliosis, or any abnormalities that may be noted, and none are. And I'm going to palpate her spine, moving from the cervical, thoracics, and lumbar, noting any tenderness, nodules, swelling, any abnormalities. Is anything tender?
Mm-hmm.
Okay, now I'm going to do a neck range of motion. Flexion would be chin to chest, extension, and rotation side to side. And then I'm going to do a spinal range of motion, and I'm going to ask her to bend forward like this. And then that's flexion, and then extension to bend backwards like this. And then rotation. And then lateral bending. And all those are normal. Now I'm going to inspect the hips for any abnormalities, if one side of the hip is higher or lower than the other side, and any kind of like swelling, rash on the skin, and it's all normal. Now I'm going to look at palpating the hip for any tenderness, swelling, any nodules, and none are noticed. Is it tender?
Mm-hmm.
Now for range of motion of the hips, I'm going to do flexion. I'm going to bring one knee like this, and extension, okay. And then I'm going to do abduction, which I'm going to move the leg away from the body, adduction, like that. And no range of motion abnormalities was noted. For the flexion, 120 degrees is normal. For internal and external rotation, it's about 45. Now I'm going to inspect the knees for any swelling, abnormalities, any fluid buildup, nodules, or any lumps or bumps. And then I'm going to palpate the knees for tenderness. Is it tender?
No.
Okay, now I'm going to do range of motion for the knee. Flexion, extension, rotation, now I'm going to be looking at the ankle and foot for any inspection of any abnormalities like a nodule, swelling, any bumps or lumps. And now I'm going to palpate for tenderness. Any tenderness?
No.
Okay. Now I'm going to do an ankle flexion and extension, range of motion. And then inversion and exversion. Okay. Now I'm going to test for the upper extremity rapid alternating movements, and I'm looking for abnormal, which is also called dysdiadochokinesia, and I'm going to have her alternate her hands like this and continue to do that. Okay. And then I'm going to have a lower extremity rapid movement test. I'm going to have you tap your foot like this. Okay. And then I'm going to do a point-to-point movement test. So I'm going to ask you to touch your nose, alternating your hands. Okay. That's good. And then I'm going to look at your walking. Just stand up and walk that way. Just normal walk. A heel to toe walking. Okay. Now walk back on your toes. Now walk back on your heels. Okay, perfect. And then now I'm going to do pain and light touch of the upper extremity, proximal and distal, okay? You just tell me if you feel it the same here as you do on the other. Same?
Yes.
Okay. And now for the lower extremity.